Good afternoon. I'm Terry Keys from the Markey Cancer Center and a staff senator from UK College of Medicine. I'd like to welcome you to today's monthly installment of the Lunch and Learn series, which is sponsored by the UK Staff Senate and its Professional Development Committee, on which I'm a member. Our next Lunch and Learn will be held on May the 20th, the third Friday of the month at noon, and you'll be receiving more information about that through our listserv on our website. Speaking of websites, you will be able to view this Lunch and Learn and all the past Lunch and Learns by following the link that I'm going to post in the chat in just a second. And also, it's almost election time for the UK Staff Senate, and nominations, which include self-nominations, are being accepted through April the 30th. So you can find out more about that process on our website too, and Chris is going to pop that into your chat in just a minute. So we encourage you, if you're interested in all things UK, that you would nominate someone else or nominate yourself for that process. And then the elections take place in May. Lastly, if you have questions for a speaker, if you use the reaction button at the bottom of your screen to raise your hand, as they say, I will acknowledge you. And otherwise, you may type your question in the chat and I'll ask the question for you. And you could also unmute yourself. That gets a little bit clumsy sometimes. So if you just want to put a chat, I have a question, I can acknowledge you that way too. Now for today's session, titled Holistic Health, Whole Person Health. Our speakers today hail from UK Healthcare's Integrative Medicine Health program. This program focuses on the interaction of mind, body, and spirit to treat the whole person, and providers use all the appropriate complementary therapies, such as health, and as well as healthcare expertise and traditional disciplines to help both patients and healthy individuals achieve optimal health and healing. This coordinated and holistic approach to care has been proven to decrease pain, reduce stress, improve mood, strengthen the body's immune response, limit inflation, and instill a sense of hope and well-being. By incorporating a variety of evidence-based therapies, such as yoga, massage, aromatherapy, and other services into their care, they give our patients, faculty, and staff even greater opportunities to reach their health and wellness goals. Joining us today are Amanda Biddle, the practice manager for the clinic, who began her UK career in Markey's Head, Neck, and Respiratory Clinic. And Jill Cole is the massage therapy coordinator and is working toward a PhD in rehabilitation medicine at UK. Thanks to both of you for presenting Holistic Health, Whole Person Health, and I'll give the floor to you. Thanks so much.
Thank you, Terry. I really appreciate the opportunity to be here today and to talk about integrative medicine and health services at UK, and also to talk about massage and some other services that we have. So Amanda and I are really excited. Before we dive in, before we begin, what I'd like to do is, I know everybody, we're all so busy and we're pulled in so many different directions. I would just like to lead us through what I call a mindful minute, just a very short meditation that I find helpful, that I do throughout the day. So if you would, you can keep your camera on, or if you want to turn your camera off during this mindful minute. I'd like to invite you to just get into a comfortable position in your chair and make sure that your feet are flat on the floor, or if you want to, if you have an area that you can lay down in, that's fine too, but I also find it helpful just to get into a comfortable position. And I want you to listen to the chime. I have my headset on, but I think you'll be able to hear it. So I'm going to do 3 chimes. And if you want to, as you soften your eyes, or you can close your eyes, and as you hear the sound of the chime, I'm going to do it one more time. Just start noticing your breath. Just make observations of how you're breathing. Just breathe normally, how your breath is coming in through the nose, how your nostrils might be lifting, how your chest might be expanding, how your breath comes in through the body, how it nourishes your body, and how it goes out of the body. I invite you to breathe in peace and breathe out anything that you need to release. Still focusing on the breath. If you feel your mind start to wander, just make an observation. Just notice. And then anchor back to your breath. Breathe in joy. Breathe out distress. Breathe in energy. Breathe out fatigue. In just a moment, you will hear the chime again, and that's a signal for us to just return with soft eyes back to the meeting, just noticing your breath. Well, thank you. I often find it's helpful just to have even, I call it a mindful minute, but that might have been maybe 2 minutes or so. I find it helpful for myself throughout the day to have some time. Oh, good, Stephen. I'm glad you feel much more relaxed. It's so important for us. Our sympathetic output is so turned on each day. And what I mean by that is our sympathetic nervous system, our fight or flight, we are always kind of on the go. And it's really helpful to help our brain kind of settle and just give our bodies time to get into the parasympathetic, which is the rest and digest part of our nervous system. And the other side of it is the tend and befriend. I love that term too. So we're tending to ourselves, we're befriending ourselves. So thank you all. So you can do a mindful minute anywhere. It's a little challenging when you're driving. That might be a contraindication to the mindful minute, or handling other heavy equipment and so forth, but it's a really adaptable meditation piece that you can do pretty much anytime. So I'm Jill Cole, and I am the massage therapy coordinator at Integrative Medicine and Health, and here with Amanda Biddle, our practice manager, and we're just so excited to talk about integrative medicine. And Amanda, if you want to, I think she has control, or whoever has control of the next slide. So I want to kind of start us out and talking about our in-person services. We are a wonderful, restorative, healing clinic in the Markey Cancer Center, and we're on the 3rd floor of the Whitney Hendrickson building, and it's beautiful. We have 5 treatment rooms that we have available for massage therapy and acupuncture services, and we have a multi-purpose room that you can come, and actually we can have up to 3 people meditating from 11 to 1 during the week. So if you have some time, you want to come over, you just drop in. We have space to meditate, and which we're really excited about. So we have massage services. We can for 30, 60, and 90 minutes. These are some of the in-person services. We have wonderful relaxation, therapeutic, oncology, and prenatal massage. And we also have aromatherapy, Reiki, and hot towel or moist therapy treatments that we don't charge. Those are add-ons. And acupuncture is $110 per session, and then insurance approvals vary. And Amanda will talk about that a little bit later. So I would like to kind of start us out. Actually, I'm going to talk about acupuncture. I apologize. So if the next slide. So we have Colleen Corcoran. Dr. Corcoran has been driving our acupuncture for a while. She's been with us for over 3 years, and we're very lucky to have Dr. Corcoran. And we've just onboarded Dr. Dennis Kim and Dr. Nora Charles, who will be starting here in the next month. And essentially, acupuncture initiates and facilitates the body's natural ability to heal itself. And in addition to a wide variety of health conditions, here are some of the other benefits, which include reduced muscle tension. It just can melt away muscle tension and pain and anxiety, improved immune response. It helps to stabilize the mood in the body, and better sleep. And acupuncture follows the meridians of the body, or the qi, the natural flow in Eastern medicine that the doctor, the acupuncturist can assess where the needles are placed in the body, and it really helps to improve overall health and well-being. So you can experience benefits beyond the site or problem being treated. Oftentimes, an area of concern or an area that is causing pain or discomfort, perhaps in the shoulder. Sometimes there's needles that are treated in the shoulder, but also in more distal areas, hands and feet can also bring improvement to those areas as well. And it's minimally invasive. So I don't know if you all have ever experienced acupuncture before, but the needle placement is very superficial. It's like you can hardly feel it, but you feel this really relaxing, stimulating nerve-rich areas that influences tissue, gland, organs, and various functions of the body. So it's just a very powerful treatment. And we're so excited that we're onboarding 2 incoming providers, so we can offer this treatment even more than we're doing. Dr. Corcoran stays pretty booked up well ahead, as you can imagine, and she's also really excited to be onboarding some more providers. So that's some of our acupuncture. And the next slide, go ahead. Yes,
hello. I was just going to add in, if you have not experienced acupuncture and you're curious about it, you do not have to have a physician referral to come in. Our acupuncture services, you can refer yourself for any sort of condition that you may see this helping. Our providers coming in have specialties in depression, anxiety, women's health, and palliative care. Our providers also provide services, or will be providing services, in the inpatient setting. There's a way for our other UK healthcare providers to put in a referral for our services, and we can provide it in the hospital or schedule patients based on those referrals at our outpatient clinic as well. As far as UK healthcare goes, if you'd like to come for acupuncture, it is a $20 copay for PPO, healthcare insurance plans, and a $15 copay for the HMO healthcare plans. And beyond that, if you are not on a UK healthcare plan, a lot of insurances are not currently covering it, and we hope that changes in the next few months, but it is $110 per visit.
Thank you, Amanda. And yes, Katie, we can definitely share these slides via email and send the info for acupuncture and so forth. We'll make sure that everybody gets a copy, and you all know where to find us. So absolutely. definitely. So the next offering that we have that's definitely in my wheelhouse is massage therapy. So I love to brag. Absolutely, Judy, thank you for sure. The insurance payment plan info, and we'll get some more information too with the specifics. I feel like I'm very biased. This is a very biased term, but I feel like I have the best massage team around in Central Kentucky. I'm just so proud of the team that we've built with massage therapists. They come to work each day when they're here. They bring their heart, their soul, their mind. They love what they do. They love providing massage for the patients, whether it's inpatient, in bedside, whether it's during infusion. They love whether it's in Kentucky Children's Hospital, Good Samaritan Hospital, Chandler, or it's here at our clinic. And so they're at level of expertise and years of experience and specialty training really aligns and sets them up for success to be able to provide the best services to our patients, staff, and family members and individuals outside of UK. So there's myself. We have Kimberly Tackett, Teresa Hammonds. Kimberly is in works 2 days a week for Kentucky Children's Hospital, and she's 2 days a week in our clinic. Teresa Hammonds is a PRN that works 2 days a week with us. Daniel Napier is the first full-time massage therapist at Good Samaritan Hospital. He was hired on the 1st of January, so he is specifically designated to Good Sam, where he's working inpatient and just doing wonderful work with the patients at Good Sam. And he also has a massage chair over there, so he seeks out staff when needed. So he takes care of the patients first, then the family members if they need some massage therapy intervention and assistance, and then staff. And then Jessica Kidd and Beth Smith, there are also two of our other PRN massage therapists that work helping do chair massage. We've been tasked with a lot of chair massage with COVID, so we've been working with staff. We've done since September in response to the Delta and Omicron surge. We have done well over 1,600 chair massage to our staff alone. And we've been in over, I want to say, close to 50 departments in UK healthcare alone. So that we've been really, really excited that we've been able to do that. So massage therapy, you all may have had massage before. It involves a structured touch, holding, pressure, manipulation of the soft tissue to promote healing and a sense of well-being. And there are different approaches to massage, which I'll emphasize. We really personalize each session in the clinic, one-on-one method of care. And so we really try to, it's how we look at it, it's the patient's time. And we want to look at the health record, the intake, the goals of massage, and really align all of those pieces to make the best experience in it with a safe, educated touch that we can. And we also do this with patients in the hospital too. We're bedside, where we're doing 15-minute hand or foot massage. We have an IRB going right now where we've shown a 25% decrease in pain just from one session of massage with a 15-minute hand or foot massage, and a 60% decrease in anxiety of the patients. We've done pre and post measurements, and that's just really exciting to us. So that says there's something here that we need to build on a little bit more. And so that's what we're doing inpatient and infusion and so forth. But some of the other benefits that we've seen over time that are evidence-based is there's so much evidence with massage as a non-pharmacological approach to pain, as an intervention to pain and anxiety. And there is so much data to talk about the reduction in healthcare costs with the use of massage therapy in non-pharmacological approaches to pain. In addition, as a rule of thumb, but when I taught massage, I would teach my students, don't use your thumbs. You don't want to blow out your hands and so forth. So as a rule of thumb, I feel like it's important to get at least a massage once every 4 weeks to really help the body decompress, to help any areas that may be cemented from sitting, from just stress levels. I think it's important for us and I get one every 2 to 4 weeks myself. I have mine scheduled for tomorrow. Actually, I try to practice what I preach, and I get excited about it. As much as I love doing massage, I also love receiving. So I really recommend one every 4 weeks. I have patients that have seen me for years, weekly, bi-weekly, every 3 weeks, every 4 weeks, sometimes every 6 weeks. So I think that's a good rotation to really do for yourself. And we have wonderful therapists right here that we can see Monday through Friday, 8 to 5, and Thursdays we've launched, and Amanda can talk to you a little bit more about this, but we're seeing taking appointments up to 8 o'clock on Thursdays. So we're really excited about that. So pain, chronic use issues, overuse issues, those pieces, to promote a sense of well-being, to really just help relax the body. I think relaxation is one of the most important gifts we can give ourselves, because what I talked about in the beginning, that sympathetic output. So anything that we can do, and all of the things that we're talking about today really helps that. So yeah, I need to stop myself. I get excited about massage. So I'm going to just pause. Yes. Jill, I think it's important to note that our therapists work with patients with wounds and scars. Absolutely, Terry. So our therapists work with patients that have wounds, have scars, are going through active treatment for cancer. So we have our therapists are highly trained to work with someone going through cancer treatments, and that translates to safe protocols for all hospital patients. So that's absolutely, Terry. I really appreciate that point for sure. So essentially medically complex individuals, we have that training, and we can safely work in touch with most anybody in the hospital. Contact precautions, those are things that we look at very seriously, obviously with COVID, but aside from that, we can make adjustments. So thank you.
Just Jill, I'll just chime in here, because I think most people, when we think of massage, they think about, oh, let's do it on a Saturday afternoon and get all relaxed. But actually, yes, that is there. But for our intents and purposes, it's the therapeutic massage that they're working on. So for instance, if you were a breast cancer patient and you had a mastectomy and you were having scar tissue issues, then your massage therapy therapists are trained to work with breaking up these types of blockages on skin, incisions. So there are all kinds of ways that people in today's session would have reason to come other than relaxation. So if you've had broken an ankle and your legs hurt or they swell or something, there'd be all kinds of reasons to come to someone at this clinic than it would be to maybe go to another one that's out in the public.
Absolutely. Absolutely. That's a great point, Terry. We really pride ourselves on really trying to make, I love the term adjustments in rather than, I said contraindications before, but I love the term adjustments. So we have the training to make those adjustments, to meet people where they are, work with any individual with a spectrum. I have patients that are very complex medically that come to see me, and I really value that time just as much as the patients that come in for relaxation. So absolutely. So
our therapists also have access to Epic the same as any other healthcare provider at UK. And so if your provider has recommended massage or you want to talk to them about that, they can also send referrals over our way. That doesn't change the cost because it's not covered by insurance at this time. But that does mean that we would have access to the health record to make sure that we are using all the proper protocols for our medically complex patients.
Absolutely. And we're charting in Epic. So the patient, whoever comes in for the massage, can look and see in their chart and see that chart and see the progress that we're making and so forth. So we've got some really good validation tools within our massage charting to show people like, yes, this is working and why. So
yes. And as a bonus, our massage therapists and acupuncture providers are able to work together to even have treatments on the same day if that's something within your treatment plan or that you're interested in, so that you could come in for a double back-to-back appointment, which ends up providing a lot of extra healing for your body. All right.
Absolutely. Thank you.
So animal-assisted therapy or pet therapy, a lot of people around campus know this as our dog teams, is something that falls under the scope of integrative medicine and health. Our animal therapy teams are made up of 60 plus volunteers because we continue to onboard new teams. So the human parts of those teams are volunteers that are onboarded through UK Volunteer Services. But then the program is ran by our animal assisted therapy coordinator, Susan Leppert, and her name is up there, and she is a great contact. Throughout COVID, our therapy teams have been limited to being able to see staff only. So they have been around campus, some of our satellite locations, and now that we are in Tier 2, they are getting ready to also be able to see patients. But with our animal-assisted therapy program, studies have shown that animal-assisted therapy can lower stress-related cortisol levels, decrease anxiety, reduce pain levels, help lower blood pressure and pulse, a lot of things that go along with just the recommendations for people to have pets at home. Those benefits are transferred to the hospital. Our therapy teams have only trained therapy dogs who go through special training to be at UK Healthcare. And they right now offer inpatient services. Our providers in the hospital setting can actually put in orders for animal therapy for a therapist to come and visit with patients. They can use that to lower stress. They can use it on patients who are experiencing extreme anxiety. Our animals love going to Kentucky Children's Hospital, and they can visit before and or after procedures to help reduce anxiety and fear of procedures. They can be in there while the provider's in the room or just while the family is in the room. And they also help patients going through trauma. Our therapy teams can also go to patients during end-of-life care to provide kind of pet therapy assistance to help reduce anxiety and depression, but also we have the ability to kind of match with maybe a pet that they've had to leave at home. And so that pet can be with them while they're going through that experience. Our animal-assisted therapy teams don't see patients in an outpatient setting currently, but that we are always open to that. So if you work in an area and you would like your staff to have visits by the animal therapy teams, you would contact Susan, the coordinator. Or if you know that you have patients who would benefit from the service, you can contact Susan or put an order in. And all animal assisted therapy services are free of charge. So there's no charge whatsoever for the patient or the staff. We have narrative medicine services. Dr. Robert Slocum provides those services. They are all currently telehealth services. This started during COVID, and it will probably stay the same because we've realized that there is a lot more access for patients throughout the state who are UK healthcare patients to receive narrative medicine services. During your telehealth session, you can rediscover your identity and meaning of your story as a person. It is very similar to behavioral therapy or talk therapy that people are familiar with. But instead of just focusing on one issue, Dr. Slocum strives to have a whole health focus and help somebody who is going through something make a new identity for themselves and kind of rewrite their own story, including their new health problem that they are going through or life issue or work issue that they are going through. His methodologies help improve the person understand themselves, help them become more open about what they're going through, and find meaning and hope and strength in whatever they are struggling with. The benefit of narrative medicine is it is also free of charge. You are able to email or call our registrar, Tania. I put her information in the chat, and she can schedule appointments with Dr. Slocum for you. It's not run through insurance at all, and so there's not a limit to the number of appointments or sessions that you can have with him. And you are also able to reach out and email Dr. Slocum yourself. He specializes in medical struggles or situations, especially within the cardiology realm, but will see anybody for anything that they're going through. And it's a great service to even just explore if you are interested in learning about narrative medicine and how it can help you or how it could help patients that you treat. Music therapy and art therapy are next. So we are integrative medicine and health, and that also encompasses our creative arts program. I'm going to go through them quickly though, because these two programs are inpatient and they are primarily set in Chandler and Kentucky Children's Hospital. We do have therapists that go to Eastern State Hospital and a new music therapist who started at Good Sam. But these are not services that are available for staff currently. They are just available for patients who are in the inpatient setting. But with music and art therapy, they are able to treat a variety of emotional ailments and fatigue and pain. Within music therapy, the therapists go in. It usually takes more than one session. They get to know the patient. They often figure out what their favorite type of music is. They're able to play their favorite songs. They can play instruments together and just kind of really uplift emotions within that hospital setting. With music therapy, our therapists are also trained to do heartbeat songs, and so they can record heartbeats of infants or heart transplant patients and put those to recordings to a favorite song for the family to take home, so that they have their child's heartbeat that's been in the NICU, or they have their old heartbeat and their new heartbeat for our heart transplant patients. That's something that I thought was really neat. And then our art therapists do the same. They go into the inpatient setting and they use different means of art to help a person's physical, mental, and emotional health. So they are there with them, usually for about an hour, to go over and allow them to talk while they're working on different modalities of art. Yoga, we are very excited that now we are in Tier 2. We can have small in-person yoga classes. However, during COVID, our yoga has been primarily online. Our yoga is funded right now completely through a grant, so it is a free service to all staff and patients. We have yoga by Melissa Condor on Wednesday nights from 7 to 8 o'clock. If you are interested in joining that yoga session, you can email our integrative medicine email address or reach out to our registrar, Tania, who I've put in the contact, to get that link for the Zoom. It is, again, free of cost, but yoga is used as a gentle movement and breathing to relax the body, reduce stress, pain, and fatigue. So our yoga is really based in relaxation yoga. You can use yoga for strength building as well, but our classes right now are just focused on stress reduction, pain reduction, and fatigue reduction. It promotes positive physical, mental, and emotional changes, and our yoga classes are suitable for all skill levels. Melissa is the yoga coordinator as well. She can set up one-on-one yoga sessions if you are interested in trying it, but maybe a little bit nervous. She can also set up group yoga sessions for your department. She does chair yoga, so we've recently had a department that called her in and they did a virtual chair yoga session during their lunch break. And they were all able to do chair yoga with her for 30 minutes for everybody in the department to just kind of take a mindful break and stretch and relax some. And she is able to do that with any department, and it's still free of cost. She is able to set up outdoor yoga as well. If your department has space where you could do not chair yoga, regular yoga, she can set that up too. And then we will be adding in-person yoga classes in our multi-purpose room that Jill was saying is also used for meditation shortly, since we are in Tier 2.
Great. So
go ahead.
Go ahead.
I'm going to turn it over to Jill.
Yes. So I would love to talk about Reiki. And Reiki is a form of energy work. It's non-invasive. It's a Japanese healing practice. And we have two providers right now, Teresa Hammonds and Kimber Tackett, that provide Reiki in our clinic. And they will work with patients that come in the clinic or bedside, if they're working bedside or an infusion. So it involves really the placement of hands above or gently on the body and using the life force energy or the chi, or in Japan, it's called ki, QI, the energy, to facilitate relaxation and stress reduction. And it's a really gentle form uh, uh, of healing practice that really helps somebody, especially if somebody is very, very ill, and they may not really be able to handle a lot of touch at that time. So it's really personalized to individuals' needs and preferences. Sometimes clients love it integrated into their massage session. Typically, the client is fully clothed, and some of the benefits of Reiki includes pain reduction, anxiety, improving sleep, decreasing stress and depression, and also accelerating recovery after a surgical procedure. So this is one of the main benefits as well with Reiki. It's another practice to help that sympathetic output, to help us really slow down and become more in our bodies. I think what I've noticed over the years is that, especially in our culture, we stay in our head up most of the day. We're really thinking and thinking and thinking. And when we can have time like a meditation or a mindful minute to really settle into our bodies, or receive acupuncture or massage, or really reach out and work with animal assisted therapy and narrative medicine, that really helps our bodies. And Reiki is another way to really help, that we've seen would help with patient care. So, and then I want to talk about, from Reiki, I want to talk about another movement therapy that we offer in the clinic, and that's Tai Chi. So some of you may have taken a Tai Chi class or practice Tai Chi now. I think it's just a really powerful form of movement therapy. And Dr. Slocum, who also is our narrative medicine provider, is fourth level black sash. I can't say it. Fourth level black sash Tai Chi instructor. And it's a form of moving meditation. It's a slower, it involves deep breathing and gentle movements. And it builds with our natural energy and encouraging, really centering our focus, our hata, which is our focus, our heart and hata, that we align the mind, body, and spirit. And it promotes resiliency and flexibility and wellness, while also energizing and relaxing the body. And I love doing Tai Chi. It's a practice that I want to, on a personal level, practice more. And Victoria, right now we don't have virtual Tai Chi. That's a great question, but I think that's one of our goals that we want to look at doing, because we did have it in person prior to COVID. But I think that that's definitely something. Amanda, do you want to speak to that? I know you and Dr. Slocum have had discussions for that.
Yeah, Dr. Slocum is doing a virtual Tai Chi session once a week right now. And that is also something that you can schedule by emailing him or talking with Tania. But it is just once a week due to his narrative medicine schedule being virtual as well. But we have added that in and seen the benefit of that. And it is also another no-cost service that is provided through grant funding.
Absolutely. I think our services really align. I get really excited about directional strategies, and that I believe directional strategies help to ground us as an organization. And the strategic plan about taking care of each other is something that really aligns well with what we do at Integrated Medicine, and things like Tai Chi, yoga, meditation, massage, acupuncture, and beyond. These really help us take care of ourselves and each other. And yeah, absolutely. I'm glad you all are excited about Tai Chi. And could we put Dr. Slocum's email in the chat? Amanda, is that something we can also do for everybody to have?
It is robert.slocum@uky.edu,
Okay.
but I can get
Okay.
that in the chat as well.
Thank you so much. Sometimes with multitasking, talking and typing at the same time, I stumble over myself, either with talking or typing. But yeah, I encourage you all to think about ways. For me, I often feel like there's always, it's never too late to put a moment of wellness back into your day, or to recalibrate and readjust. And I think the offerings that we have at Integrative Medicine really speak to the whole person health. Oh, thank you, Terry. Absolutely. And whole person health is that all of our body, mind, and spirit, whether it's from a disease or an injury, there's something that needs to also be supported. And we just are really excited to be able to offer these things. So thank you.
So that does end our shorter presentation, our overview on the services that we do offer, both inpatient and outpatient, for both patients and staff. And Jill and I are happy to answer some more questions, and we will be able to send these slides out to anybody who wants them. And I know that we're working on getting contact information for everybody as well.
Absolutely. Thank you, Victoria. Appreciate it.
Well, thanks to the both of you for your presentation today. We really appreciate it. There are all kinds of opportunities for those of us on campus and for those of us who might have family members who are going to be needing those services through UK Healthcare. So if you have questions, I know we've had several things in the chat, but if you have any specific questions, now's a really good time to ask those. For Nita asks, is there a cost for the Tai Chi?
There is not a cost associated with Tai Chi.
So could we just reiterate, because I know we started with the acupuncture, which does have a cost associated with it. Could we just reiterate which ones have fees associated with them and which ones are free for UK healthcare staff and faculty?
Yes, currently we are lucky enough that massage and acupuncture services are the only cost-associated services at Integrative Medicine. Our narrative medicine, animal-assisted therapy, yoga, art therapy, music therapy, Tai Chi, and narrative medicine are all free of cost for both patients and staff, and those are funded by both grants and gifts, and we feel very fortunate in our clinic to be able to offer that. With massage, your cost will depend on, it is completely out of pocket, and your cost will depend on the length of the massage, but all the add-ons are free. And then with acupuncture, Tania, our registrar, can work with you to find out if your insurance covers it or not.
So we've gotten a note from several people actually that it's opened up all kinds of questions. So, so they want to know about the specialties of the new acupuncture providers.
Okay, the new acupuncture providers coming in, their specialties are palliative care, women's health, and anxiety and depression.
Okay, so that I think that answers for Aaron. Shoot, you had a question about do they have both depression, anxiety, and women's health notes, but I don't know if that was the original how you started the. Oh yes, so that actually does directly answer your question.
Okay.
Well, what I was asking is, do both of the new providers specialize in both things, or is one more specialized than the other? I mean, like, is one specialized in depression, anxiety, the other specialized in women's health, or do they both do both?
They actually, crazy enough, both do both. Oh, we ended up bringing in providers with the same specialties.
That's fantastic. Thank you.
Yes, you're welcome.
More selection, that's always a nice thing. And then one of them wants to know which ones, if any, are available for families of faculty, staff, and staff.
Yeah, basically, all of our services are open to anyone and everyone, whether they're associated with UK as a patient, faculty, staff, or if they're outside of UK, anybody can come.
And if I'm not mistaken, you don't need a doctor's recommendation for any of those things, except of course for the inpatient.
Correct.
The inpatient ones, right? So your music and art therapy, are sort of a different animal than these other things.
Yes, music and art therapy will be the only ones that you would need to already be a current UK patient, and it would be inpatient. But everything else is open to faculty, staff, and their friends and family. Anybody can come and participate with integrative medicine.
Could we clarify what is available to the general public versus staff versus patient?
Sure. So in terms of massage, what is available to the general public is any of our outpatient services with massage is available to patients who are ambulatory, of course, family members, friends, faculty, staff members. So, and that is also for acupuncture too. So that's also true for acupuncture.
All right. And then can our FSA funds, can those be used for massages or acupuncture and any of the other things?
They sure can.
Yes.
Okay.
Yes.
That's what I do. So it does work.
Well, that's fantastic. And
Yes.
then Stephen Reed notes that he was on the Integrative Medicine Health website and he found that there were some YouTube videos on there. Could you talk a little bit more about what's available on the YouTube? And if one of you has the link to the YouTube, we can put that in here.
Yes. You want to talk
Or
about
Stephen,
that?
or Stephen, if you have the website, if you're just not looking at it, if you can just pop that in, that would be great too.
Yeah, we made a lot of videos, I think right at the beginning of the pandemic. It was prior to me coming in as practice manager, but we have short yoga videos, self-care videos, and self-massage acupressure videos, if I'm not mistaken, that everybody can have access to be able to not have synchronous classes, but be able to have asynchronous learning for all of those modalities.
Great. So, so if we can just get the YouTube, I'm sure you could probably search it on there, but if we have it, so we can list it in the chat. One thing that I wanted to note, and the reason I know a little bit about the Integrative Medicine Health Clinic is I facilitate Marquis Patient Advisory Group, and actually that entire clinic sort of started, well, it didn't sort of start, it started with a pilot project that we did just for cancer patients. So when this whole clinic was being started, it was piloted through Marquis. And of course, we had patients in all kinds of treatment regimens, surgeries. And so that's why I knew that the massage therapy was specifically for patients who had all kinds of issues, and they weren't just coming in for, I want to feel good for the afternoon. They were dealing with pain, they were dealing with stitches or other types of surgical scarring. Mastectomy is the one that comes directly to mind because, you know, particularly if you're going to have reconstructive surgery, that can be an issue. So I wanted to make sure that all of our listeners today understood that, you know, if you have friends, family members, neighbors, whomever, who have these types of issues, they've broken an ankle or they've had a surgery incision that's not doing quite what they wanted to do, this is really a fantastic place to have someone who's trained specifically with wounds, scarring, and those types of things. So if you had a shoulder that was out of kilter, this is a way that you can get somebody who has a medical training background, not in medicine, but in working with medical patients. And it's a fantastic resource for all of us in our community.
Yes, so that kind of, thank you so much, Terry. That definitely sets our clinic apart from other spa-like massage therapy clinics in the area. And I'd like to add that as we add these new acupuncture providers on, we also plan to be able to start working with those same cancer patients in order to provide acupuncture services in conjunction with their infusion treatments to help alleviate the pain, anxiety, and nausea that can come with that, because we are in the Whitney Hendrickson building, which does house a lot of the infusion patients, and they'd be able to come up to our clinic to receive acupuncture as an additional service after they're finished with their infusion.
I will also say that, you know, that clinic, as you said, is in our Whitney Hendrickson building on the 3rd floor. And it is a beautiful, beautiful space. You are not going to find any clinic at the University of Kentucky that is more beautiful than that one. It's open, it's airy, and it's an incredible space to relax. There's the natural light that's in there is just beautiful, and it has been designed for the whole patient from the moment you step in the door. So I would encourage you to give them a call or send them an email and come take a look at it if you're interested in what, or if you're not interested, you can at least see what's there. It's a fantastic offering. Any other questions? And again, you can put those in the chat if you want to. I'm going to remind you that it's also time for Staff Senate and nominations for that. Elections come up in May, so I'm going to put that in here right now. So if you enjoyed today and you'd like to be a part of this going forward, as far as professional development, we have an elections committee, we have staff resources committee, we have all kinds of ways that you can get involved in what's going on in the University of Kentucky campus. Any last words from our speakers today?
I just want to say thank you so much for having us and let us talk about our wonderfully beautiful and little clinic at UK. I appreciate it, and I hope to start seeing some of you guys for meditation or some of our services.
Absolutely. Yeah, thank you for having us, Terry. And we just very grateful that we're able to do what we do with UK and be a part of the bigger scope with patient care and taking care of each other. So thank you all so much. It's been great.
We're happy to have you. And just remember, next month, May the 20th, we'll be back again, and that's going to have a bench toward finances. So we hope that you will come back for that. And you'll be receiving more information on that through our email channels so that you can register for the next one. So you'll have a wonderful day, and thank you again for attending.